Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to our third vlog. Let's be clear. Resmetirom is not a magic bullet. MASH is a multisystem disorder and its treatment must be equally holistic. Every patient on resmetirom should continue intensive lifestyle modification, weight loss of 7 to 10%, calorie control, and exercise. Metabolic optimization is key. Tight glycemic control, statins if needed, and antihypertensives should not be neglected. Behavioral counseling and nutrition support should be part of care plan. Resmetirom offers an added advantage, especially for those struggling despite these measures, but only as a part of an integrated patient-centered approach. Through a multidisciplinary approach, we can maximize outcomes and truly improve quality of life for our MASH patients. Bismillahirrahmanirrahim. Efficacy and safety of resmetirom in the treatment of MASH. MASH encompasses a spectrum of liver conditions ranging from MAFLD to MASH to fibrosis, cirrhosis, and HCC in the presence of metabolic syndrome. It affects approximately 1/3 of the global population. In Western countries, MASH prevalence ranges from 20 to 30%, while in Asia it varies from 15 to 45%. The prevalence of MASH is closely associated with the rising rates of obesity, type 2 diabetes, metabolic syndrome, and sedentary lifestyles. The primary management strategy for MASH involves lifestyle interventions focused on weight loss, dietary modifications, and increased physical activity. Although lifestyle modifications and weight reduction are beneficial, they are often difficult to sustain. In contrast, bariatric surgery and first-generation anti-obesity medications can be beneficial but less well tolerated. The pharmacological therapies include insulin sensitizers, that is pioglitazone and metformin, lipid-lowering agents, statins, ezetimibe, antioxidants like vitamin E, agents targeting liver fat metabolism and inflammation, elafibranor, obeticholic acid, incretin mimics like GLP-1 receptor agonists, liraglutide and semaglutide, and thyroxine hormone receptor beta agonist, that is resmetirom. The thyroxine hormone receptor beta activity is vital for the hepatic lipid metabolism. THR beta is highly expressed in liver and involved in regulating lipid metabolism and inflammation in the liver. By selectively activating THR beta, resmetirom modulates genes responsible for lipid metabolism, increases hepatic fat metabolism, and reduces lipotoxicity, thus leading to reduced hepatic fat accumulation and inflammation. This beta selectivity also protects against the systemic adverse effects of excess thyroid hormone activity, which are mainly mediated by thyroid hormone receptor alpha. These are the four phase 3 and phase 2 trials. The phase 2 MGL3196, which is the code number for resmetirom, NASH, then the open label MGL3196 phase 2 NASH study, then the phase 3 Maestro NAFLD 1 and phase 3 Maestro NASH studies. I'll briefly compare these four trials for you. The Stephen A. Harrison, he is the first author of all these four trials. The MGL3196 phase 2 NASH study was conducted in 2019 in United States at 25 sites. It was a multi-centric, randomized, double-blind, placebo-controlled phase 2 trial. Sample size included 125 patients, and the treatment duration was 36 weeks. Then the OLE MGL3196 phase 2 NASH trial. Again, the first author was Stephen A. Harrison. It was conducted in 2021 in United States in the 12 sites, and it was an active treatment open label extension OLE study of randomized double-blind placebo-controlled phase 2 trial. Sample size included 31 patients, and the treatment duration was 36 weeks. Then the phase 3 Maestro NAFLD 1 trial. Again, the first author was Stephen A. Harrison. It was conducted in 2023 in United States, and 80 sites participated in the study. It was a multicentric, randomized, double-blind, placebo-controlled phase 3 trial, and 1,143 patients were enrolled, and treatment duration was 52 weeks. Then the famous phase 3 Maestro NASH trial, which was published in a New England Journal of Medicine, and FDA gave approval on the basis of this. Again, the first author was Stephen A. Harrison. It was completed in 2024. It was published in 2024. It was conducted in the United States in 245 sites. It was a multicentric, double-blind, randomized, placebo-controlled phase 3 trial. 966 patients were included in this study, and it was 52 weeks duration study. This is the study for which the forest plot showing changes in MR eye proton intensity fade fraction from baseline to week 36 to 52 and to 12 to 16 week, a dose of 80 milligram resmetirom compared to placebo. And this is the efficacy. This is the the trials, and what these trials, pool trial says that the efficacy was there in the resmetirom group as compared to the placebo. The bars are here towards the side of the resmetirom. Then the forest plot showing change in MRI proton density fade fraction from baseline to week 36 to 52 and 12 to 16 week at a dose of 100 milligram. This was at the dose of, the previous was at the dose of 80 milligram, and this is at the dose of 100 milligram. And again, the efficacy was shown in the resmetirom group, and it was found to be superior as compared to the placebo. These are different studies, the data, and this was the efficacy plots. Then the forest plot showing treatment emergent adverse events at resmetirom dose of 80 milligram and 100 milligram versus placebo group. And what we say, this is the resmetirom group, this is the placebo group, and they were comparable. They were not, they were found to be safe. So this is again towards the safety. When the pool data of these studies were compared, the drugs were found to be safe. And this is the forest plot for mild adverse events at resmetirom dose of 80 milligram and 100 milligram versus placebo group. And again, when you see this, the pool data, it is comparable, and there is no difference between these. So the drug is safe and it is tolerable. Then the forest plot for moderate adverse event, this was the previous was mild adverse event. Then when we compare the moderate adverse events at resmetirom doses of 80 milligram and 100 milligram versus placebo group, again we say that it is comparable. Again, the severe adverse events, when we compare these severe adverse events, again, they were mild trend towards the resmetirom. The efficacy was comparable. This is the forest plot depicting the drug-related serious adverse events in resmetirom at a dose of 80 and 100 milligram, and the pool data shows it is comparable. It is not serious in the dose of 100 milligram as compared to the 80 milligram. And this is the forest plot for adverse events, nausea occurring in more than 10% for less than 12 weeks and more than 12 weeks. So the nausea, this is the, when it is the, when you compare it when it is the early or the late, and when we see that it is again comparable and it is safe. Similarly, forest plot for adverse event diarrhea, because nausea and diarrhea, these are the most common adverse events with this resmetirom, for more than 10% for early versus late, and when we see it is again the comparable. So this is, I have shown this in my first vlog as well. The article which was published in the New England Journal of Medicine on February 8, 2024 by the Stephen A. Harrison, a phase 3 randomized controlled trial of resmetirom in NASH with liver fibrosis. And the key findings of this was that the MASH resolution with no worsening of fibrosis as one of the primary endpoint was found to be superior in the resmetirom 80 and 100 milligram as compared to the placebo. Similarly, the second component of the primary endpoint, the fibrosis score improvement with more than one with no worsening of the NASH activity score. Again, the resmetirom was superior as compared to the placebo. And the secondary outcome, that was the percent change in the LDL at week 24. Again, the resmetirom 80 and 100 milligram both were superior as compared to the placebo. And when we see the adverse events, mild to moderate and more frequent in resmetirom group, they were the diarrhea and nausea. So these were the two commonly notified side effects of resmetirom. And this is the graphic presentation again, that the placebo was far much inferior as compared to resmetirom 80 milligram and 100 milligram in terms of the NASH resolution and fibrosis improvement. And this study had shown that the resmetirom, both 80 milligram and 100 milligram doses, was superior to placebo regarding both histologic primary endpoint improvement in muscle activity score and fibrosis stage. And the changes in the lipid profiles, liver biochemistries, and non-invasive steatosis and fibrosis assessments all favored resmetirom. So the conclusion, resmetirom, both 80 milligram and 100 milligram doses showed statistically significant efficacy in both MASH resolution and fibrosis improvement. And with favorable safety and metabolic benefits, resmetirom is poised to become the first-in-class therapy for MASH with fibrosis. And I'm again showing this slide. How should we apply this to our practice? First of all, identify patients at risk. And the patients at risk, these are the patients with obesity, patients with type 2 diabetes, fatty liver on ultrasound, and first degree relative with MASH related liver cirrhosis. If your patient has any one of these risk factors, that patient is at risk of NASH-related fibrosis. So what you do, you should check the FIB4, and according to the FIB4 results, you categorize the patient either into green group or yellow group or red group. In the green group are those where the FIB score is less than 1.3, and in this group, resmetirom is not indicated at present. That patient needs follow-ups. If the FIB4 value is more than 2.67, then this is the group where resmetirom should be indicated and it should be started. If the values are in between 1.3 and 2.67, then you go for the fibroscan transit elastography. And if the value is less than 8, again, the resmetirom is not indicated and you need to follow up these patients. But if it is more than 8, then the resmetirom is indicated and you treat these patients with resmetirom. So with this, I thank you for being with me. Inshallah, in the next vlog, we shall further explore the different aspects of the resmetirom therapy in the patients of fatty liver disease. This series is an attempt to have the better understanding to treat our patients, those who need resmetirom, and to avoid using resmetirom in those patients where it is not indicated. Till next vlog, it's goodbye from my side. Inshallah, see you in the next vlog with further exploration of the resmetirom therapy. Khud Hafiz.